Good afternoon. Thank y'all for coming. I'm Allison Scott, and we are going to cover several things in the academic setting. We don't have anything to disclose, and our objectives are to discuss the current evidence that exists for animal-assisted therapy and mental health, and describe the role of animal-assisted intervention in an academic setting, and how to create that in an academic setting by outlining that process. So this is Bella. Bella is my golden retriever, who I told my husband absolutely not. We were not getting a fourth dog. We already had a golden retriever and 2 rescue dogs. He came home with a puppy anyway, because he knew that once I saw that puppy, there was no way I was saying, take that puppy back. So I said, okay, fine, I'm gonna train her to be a therapy dog, because I had been in contact with Michelle. Our offices are next to each other, Dr. Kilmer. And I thought, the more I read about animal-assisted intervention, the more fascinated I became. So this is Bella at camping, the first picture. The second picture is Bella on my couch. It's actually her couch. In my office, I have had students come to my office and sit and cuddle with Bella, and I think the vast majority of students, the sea of red over here can confirm this, love when Bella is in the building. So, and then that third slide is for anyone who is not from the University of Arkansas. That's our building, Eleanor Mann School of Nursing. All right, so Bella's doing great, but I am gonna let my honor student who's doing an internship with me grab Bella. Come on. Just so we don't have any extra distractions. But Bella, it took over 18 months to train her. It is a lot of work to train a therapy dog, and it takes constant reinforcement. So, but so very worth it. So what is animal-assisted intervention? So AAI is actually the term that we should be using more often versus animal-assisted therapy. AAT is a piece of AAI. So AAI is the umbrella term. So AAT is structured, goal-directed intervention, and it's designed to improve physical, social, and emotional, along with cognitive functioning. So pretty, very goal-directed. This is what Dr. Kilmer will speak to later today. AAA is animal-assisted activity. This is really what Bella does. And it can be planned, it can be spontaneous, informal interaction for just recreational purposes. If you've been to the airport recently in Fayetteville, they have AAA. They have dogs that are there for comforting people who are afraid to fly, or just people like me that just want to hug a dog. And that can be also for motivational purposes and educational opportunities. So AAE is animal-assisted education. It is similar to AAT, but has a specific educational goal. And the trainer/researcher is trained in that specific field. Then AAC is animal-assisted coaching. And that involves a licensed coach who focuses on personal growth. So AAI really describes the use of various animals in ways beneficial to humans. So I looked this up this morning because we were talking about this at dinner last night. There's an alligator that is actually a emotional support dog, which is different from what we're talking about. But his name is Wally, the alligator, if you want to look that up. I'm not sure how that works, but there's a video of him, and the guy's sticking his hand in the alligator's mouth. But so the point is, it doesn't have to be a dog. We are focusing on canines in this presentation. So what is the emerging evidence? Dr. Casita alluded to the fact that this is really emerging science, which it is. I guess the take home of this slide is that there needs to be a lot more research. There's a huge gap in the literature on the use of AAI, specifically in higher education and specifically with higher level studies such as RCTs. And I looked actually only at systematic reviews, and it's still not clear. So randomized control trials, we need many, many more of those. Generally, the studies show a reduction in stress and in pain and in anxiety. And before I fast forward to the next slide, so this is the other reason that I am highly interested in this topic. If you know me, you know that normally I talk about breastfeeding and lactation, but this is the reason that I'm highly interested in this. That is my granddaughter who's holding Bella's puppy. So Bella had puppies in October, and we bred her specifically to produce a dog that could be trained for autism, because Hannah's little brother, who is almost 5 and nonverbal, has autism. So that is Arlo. Arlo is currently being trained in Oklahoma by the same trainer that trained Griffin, who is Dr. Kilmer's dog. So I did have an alternative motive to all the madness. And one of the things that we know in higher education is really increased rates of anxiety are being reported among students, and the data shows that increased rates of accessing services for mental health and higher ed has really increased. So the systematic reviews in higher education, so we're just looking in higher ed, emerging positive evidence exists on short-term anxiety. So we can have animal intervention and typically decrease short-term anxiety. I'll talk more about that in just a minute. Decreased stress, a person who has experienced trauma, that can decrease the effects of that. Mental illness, there's some positive data on that. And mood is somewhat conflicting. So I read as many systematic reviews as I could find, and some said yes, mood was positively affected, and some said it was really inconclusive. We'll talk why that exists in just a second. There's really insufficient evidence that it's a definite positive effect on self-esteem, well-being, and depression. And that picture is some of our lovely students with Bella. That was, I believe, a semester or so ago. It's her favorite thing to do. She loves coming to Emson and having all the students love on her. Limitations, there are quite a few. The big issue is studies really vary. So there's not even definitions. There's not this is the definition that we're going to use, and a standardized way of doing research. It really doesn't exist. So sample sizes vary greatly. The intervention itself varies greatly. So one study may have animal intervention for 10 minutes. One may have 20 minutes. One may have 50 minutes. One may have one intervention. One may have 5 interventions. And they're using the same tools. So that's a huge gap in the literature. Also, many of the studies, including the ones that I'm involved in, use a self-report tool, and that increases the bias just by the nature of the tool. So we need standardized definitions, and we need adequate intervention descriptors so the next researcher can take that study and reproduce it and have it not vary from the original study. So this describes a study that I did with a couple of honor students, and it was a pilot study. We were looking at the effect of one-on-one versus group animal-assisted intervention with our students on the day of an exam. So we had students volunteer, so it was a convenient sample. We had them volunteer, and then they were put in either, they got to spend time with Bella one-on-one or in a group of 3 to 5 students. They took a pre-test using the state trait anxiety tool. It was online via Qualtrics, so they could take it on their phone. They took that before and then after the intervention. Unfortunately, we had like 26 participate, and quite a few of them did not do the post-test, so we couldn't use their data. So we ended up with 19, which is a really, really small sample. The results that we received were that state anxiety, which is short-term anxiety, was positively impacted and was statistically significant. Trait anxiety, however, was not. So that's generalized anxiety, longer-term anxiety. So state anxiety levels post-intervention. So this is comparing the two groups. So the blue line is solo, one-on-one with Bella. The gold line or orange line is group. So what we found was it didn't make any difference, whether they spent time by themselves or whether they were in a group with Bella. That was really a pilot study. So based on that, we are getting ready to do a study on groups. Since it didn't make any difference, or we assume it did not make any difference, we're taking it'll be volunteer again, so convenient sample, but the students will be randomized into either a group where they, in a group of 3 to 5, they spend time with Bella for 20 minutes, or they do traditional peer study. So the traditional sit down with peers, study before your test. You will do one or the other. The good news with this study is it is grant funded, and I can offer an incentive. The first study didn't have an incentive. This one I can offer Amazon cards. You have to enter a drawing. It's not everyone gets an Amazon card. So this is in IRB. I'm hoping next week I get a yes on the IRB, because it really mirrored the former IRB with minor changes. So we're getting ready to start that. Is Chloe here? I don't know if my student is here, that Chloe Penton. No, she's in exercise science. So one of the things that's different about this study is the first study really just dealt with nursing students. We just logistically to access nursing students versus all undergraduate students. This study, we will have access to different majors because she's an exercise science major. So hopefully a different group besides nursing. So these are the two of the puppies. There's nothing cuter than a golden retriever puppy. So they were born in October 10th. So they're not little bitty puppies anymore. I thank you for your time, and I'm going to hand it over to Morgan Yordy, Dr. Yordy, who, by the way, is giving up part of her spring break to be with y'all. I want you to know that. And she endured 3 alarms at her hotel last night. So.
Well, thank you everybody for letting me come and spend my spring break with you. It is so much better than a rainy day at the beach, I promise. It is raining everywhere, so have no fear. Today is going to be great here. I'm going to set my alarm to make sure I don't go over time because I think I could talk about this topic a little bit too much. So this is Auburn University. Anybody been to Auburn? Some football fans, gone to games, maybe live in Alabama. Auburn is located in the southeastern United States, and it's been in existence for over 160 years, very similar to University of Arkansas. We started in 1856, and this is our main building, Sanford Hall, very similar to Old Main. I'm assuming that Sanford is pretty much placed on every letterhead at Auburn University, probably like Old Main is probably put on every paper, every pamphlet is very common. This building, was utilized as the main college. It started out as East Alabama Male College, closed during the Civil War, and then reopened, and in 1872 became a land grant institution. In 1892, it was open to women, so come a long way. And Auburn University has 12 colleges, and we have about 150 programs there. So if you're trying to figure out where we are not Auburn, Georgia. We're definitely not Auburn, New York. Very different, but we are located on the eastern side of Alabama. And I just wanted to tell you, I told a couple of students, I love your red. There's this other school in Alabama that I shall not talk. We don't talk about Bruno, and we do not talk about Bama. But their red is terrible, right? Can I get a yes? Yes, y'all's red is so much better. Kind of like our orange is so much better than Tennessee's. Agreed? Thank you. So Auburn is on the eastern side of the state. Again, we are a land grant institution, so we are all over the state of Alabama, which is fun. And we're just an hour and a half from Atlanta. So y'all, I think I understood. I keep on looking at, y'all are all undergrad students, maybe? Y'all travel a lot for clinicals. Our students do as well. We'll go to Atlanta, to Birmingham, a couple hours away for pediatrics. Our psych rotations kind of vary into different areas. So we're all over the place just like y'all are. But that is where we're located, very close to Atlanta. So the College of Nursing, this is our building. We moved into this newer building in 2017. We went from a 13,000 square foot building to a 72,000 square foot building, which is nice. We offer a bachelor's degree in nursing. It opened in 1979. We now have an RN to BSN and a concurrent program. We have a master's program, a doctoral program. And then this past fall, we started a PhD program. So that's a little bit about the college. Our students, wear orange and blue to clinical. They absolutely hate it. They want to wear all navy. But I can pick out the pumpkins at clinical very easily if they have the orange on. So as much as they don't like the orange, I can pick the pumpkins. But it's a great program to work for and be around. So a little bit about our program. Who of you grew up wanting to be a vet? Oh, there's got to be more than that. Didn't y'all grow up and say, I want to take care of animals, right? You grew up that way. Everyone wanted to take care of animals. Well, I was the same way. A little bit about myself. I am originally from Mobile, Alabama, which is the southern part of Alabama, close to the Gulf Coast. I actually left children in Gulf Shores, which is right outside of Mobile, in the rain at the beach to come over here. And I went to undergraduate at Auburn, absolutely loved it, and then moved back to Mobile and got my master's and doctorate before moving back to Auburn. But I always wanted to be a vet, right? Animals are fun. And I got my first taste of animal-assisted intervention when I was in 3rd grade. And I didn't know what it was until really I became an adult and started working at Auburn. So in 3rd grade, my parents, we have Mardi Gras in Mobile. Y'all know what Mardi Gras is? It's very wholesome activities where you just eat a lot of moon pies and king cakes, right? Maybe wear some beads, but very wholesome. Well, in Mobile, many families get out of town and go to the beach or go snow skiing or something, and I had a bad accident. And I came home with a cast up to my thigh. I went to a small private school growing up, and we didn't have elevators. I was in a wheelchair, and I couldn't go to school for a while because I was wheelchair bound. So I had a bunny rabbit named Molly, and she helped me through a really difficult time, and I didn't even know it. And that just shows you right there that animals are instrumental in our lives. At hard times in our lives, they are instrumental. And I wish I had pictures. My parents are currently moving right now, so I couldn't find that picture. But poor Molly had to endure being dressed in Cabbage Patch clothes. For you babies of the 80s, Cabbage Patch was really big. Well, as I kind of grew up, went to nursing school, graduated, started working, got married, I had a golden retriever named Frazzle. And this is my son. No animals were harmed in this. But as you see, he is pulling on her face. And as you have children, of course, things kind of go to the wayside with your poor sweet dog that you loved. And I wasn't spending as much time with her. So I got involved. You know, she was such a sweet dog. I thought, wow, what can I do with her? And our church had pet ministry. Didn't know much about taking dogs to different places. But I started going to pet ministry with Frazzle. That was kind of my, I guess, unofficial, official, really taste of animal-assisted therapy. Was it right to do that? I don't know. And we'll talk a little bit more about, you know, having your pet that you want, and I think it's great for animal-assisted therapy, but ethically, is it the right move? I don't know, and we'll talk more about that. But she was great, and we took her to different places. I was a nurse, but I didn't know much about the spread of disease. I thought everybody would want to see her, and some of the training that I had done was just not appropriate for the clientele I was seeing. She knew how to shake hands, and that's not a good idea to use, have a dog shaking hands with an older adult. They kind of scratch at them. But I didn't know. I was such a novice in this world. Well, kind of as I was working and learning about animal-assisted interventions, kind of growing as a nurse, as a mom, trying to spend time with the dog. On the other side, Dr. Pope was at Auburn University, and he worked on his DNP, Doctor of Nursing Practice, and did his project on animal-assisted interventions. He came from the Atlanta area, worked closely with canine assistants, and brought a program to Auburn. And he was great, because it takes a lot to build new programs. Some of you are probably thinking, well, it's just bringing a dog to the school, but there's a lot involved with it. You have to get risk management involved. You have to make sure your insurers are okay with it. At Auburn, we have IACUC, that we need to make sure that we're following guidelines with the animals. And then you have to have donors. What was great about Dr. Pope, and he passed away this November suddenly, but he was a reverend prior to being a nurse, and reverends are great with raising that money. So he was able to fund an amazing program called Caring Paws at Auburn University's College of Nursing. So we were able to have our therapy dogs there within nursing. He also created an animal-assisted therapy course, which is an elective course to teach others about what does animal-assisted therapy look like in hospital settings, kind of mirroring what it looked like at Children's Healthcare of Atlanta, where some of the dogs have come from. I joined Auburn in 2016, taught some of the elective courses, and really realized that what I did in 2011 with Frazzle, my golden retriever, was not correct. I started learning that there's so much more invaluable with animal-assisted interventions that I didn't understand at the time. So in 2018, we really started expanding that research and evidence-based practice. So all of this to say that really my focus is on that human-animal bond. Many of you raised your hands when you said you wanted to be a vet in a previous life or previous role. And some of you still probably think of your dogs, cats, gerbils, geckos, goldfish on a daily basis or on a minute basis because that human-animal bond is strong. And I just keep on coming back to that because that's why we do a lot of outreach and interventions at Auburn College of Nursing. We build on the fact that many people love animals. Not everybody, and that is absolutely fine. But many people have this bond with animals, so why don't I work with that? As a faculty member, if I can plug into my students and I can work with students and bond with students over the fact that we both like dogs or rabbits or hamsters, then why don't I use that as a means to get our students engaged in research, get them engaged in outreach, as well as education? So these are some pictures of our student involvement with our animals and different outreach initiatives across campus. Let me make sure I have a good time. Ooh. So as Allison was saying, the research there is just really kind of lacking with the longitudinal studies. We don't have a lot of correlation studies out there. It's very small, basic research. And even my own research journey has been small. You know, I worked with a lot of internal small grants from Auburn University, trying to learn more about that engagement with animals, how our students engage. If I have an animal present, like this is Daisy, she came from Children's Healthcare of Atlanta. She was gifted to our program, and I am her handler. If I have Daisy with me and I'm working with other populations of people, like our geriatric populations, it actually gets students involved. It's that icebreaker. If Daisy's there, the student is willing to talk to Daisy and talk to the older patients at the same time. So I started beginning to see what that impact looked like with our students. We also started working with other school systems. Many school systems are utilizing animals in their schools, and there's a lot of variation in how animals are trained and how they're interacting with classmates. So a lot of nurses do not promote dogs in schools. It's allergies, it's bites, it's cleanliness. But school counselors actually have a program of study that they go into that integrates animal-assisted counseling. So they learn more about the use of animals. So really, I'm looking at all this research, and that's why things like this, these meetings and conferences, get people thinking about, well, what can we do to really expand the research, to help our students, to help our communities, and really engage in a more meaningful, purposeful manner. So, mental health. It comes to mental health. Everything comes back to mental health and mental well-being, feeling connected in that bond, and learning that animals really do serve a role and inform relationships. We know that some of you probably have your pet left at home, and the very first thing you want to see when you get home to wherever that is, not your parents, but the dog, right? So we know that animals in our research have seen that they form this kind of connection and bond, even with our students. So nursing, I don't know if I could be a nursing student in today's world. I think it would be very difficult to be a nursing student. 20 5 years ago, maybe it was easier in some respect. There was not the challenges, but I know that having a dog and taking care of a dog was not practical with those 12-hour shifts and 2 hours there and 2 hours back. It was very hard. So having those dogs available to our students is important. Okay, so if you're looking at mental health in college students, and this is something that, yes, that's his booty. That is Sully. He is our golden retriever, a newer golden retriever that still sits like that. But more than 60% of high school students in the United States continue with post-secondary education, and that number keeps on going up. However, that transition can be hard for many. And some of you probably experienced that when you were first going off to college. I know I did when I was dropped off at the dorm at Auburn, and my parents were like, see ya. I was the last kid, and they were ready and just threw me out the door. It is hard. Eisenberg in 2023 found that over 40% of college students report some level of depression at all times, and 35% anxiety. And you're probably thinking, well, that's kind of low. These are like all the time feeling depressed or having anxiety, not just during test times, or not depression during a moment of stress or a loss. This is like a constant being reported that's of college students. And research suggests there is a link between depression and that sense of belonging, or that lack of belonging. And that's that area that I'm tapping into. Conversely, if college students feel that they belong and are engaging, they have increased motivation, academic success, self-confidence, and they were less likely to drop out of school. So just becoming more engaged is important. A systematic review of 24 studies by Kretzler found that pet owners have lower levels of loneliness. We saw that during the pandemic just 4 years ago. 4 years ago, I was on a cruise to Disney cruise, having fun until we were told that the pandemic, it was going to be the last cruise at Disney. And then we saw that uptick of people adopting animals. We don't have a lot of information out there about children and adolescents, but we do see that it helps with loneliness. Carr and Pendry in 2022 surveyed first-year college students, and they felt that if they left their pet at home, they had a little bit of pet anxiety, separation anxiety. But it was really those 1 in 4 students reported moderate to severe anxiety about leaving their pet at home, especially those that have that pet playing such a large portion of their lives. But we have a lot of reported benefits about dogs and pets as they help us through loneliness and feeling connected to others. Yet only about 4% of colleges or universities allow pets on campus. And that's why it's important for programs to really consider having animals within their colleges, because the research does show it doesn't matter if it's your own dog. Just being around a dog, if you're a pet owner or dog lover or cat lover, just being around that pet helps. So the incorporation of animal-assisted interventions in a variety of approaches really help and are very welcomed in teaching and research for students and school personnel. Dogs are most often used because they're friendly. If you see a golden retriever, I mean, you all smiled at that little booty. How happy that puppy is. And then in colleges, if you provide opportunities for students to engage in dogs, they just feel more beneficial and more welcome. When we are looking at trying to engage our students, we also know that mental health is not just in our college of nursing. We know it spans out into our communities, and we're seeing an uptick of depression and anxiety out in our communities, especially in our school-age children. So we're looking at different methods to kind of increase that mental health awareness and bringing those animals as kind of that social lubricant to get people talking. So I want to say thank you, Michelle Kilmer, for all your direction and help with learning more about your research in autism and mental well-being, because we're seeing that having resources for even our community can also help with our engagement and decrease that level of anxiety. So why am I really here? You're probably like, why is that lady in orange here? It's because I don't own red. I'm sorry, we have that other school. I can't own any red. But we're seeing that if research suggests that universities wish to reduce their rates of depression, other mental health concerns, they should offer interventions to help students. We should help our students. Novel idea, right? Find their fit in the institution. Increase their sense of belonging. And animal-assisted interventions have been shown to improve student engagement and feelings of connection. And we're seeing more and more colleges kind of integrate animals into it. So right now, I'm almost done. Right now, animal-assisted therapy, I teach an animal-assisted therapy elective. Don't y'all want that elective? Doesn't that sound like fun? Do y'all have that elective? Okay, you want that elective. Easy A. It's an easy A. No, it's a very fun elective because people in this room, you came here, unless you were voluntold to be here, you came here because you have an interest in animals. You already learned and know about that human-animal bond, and you want to be amongst animals. And this teaches you different avenues to engage with animals. But more so, it helps you get connected. Our goal is to meet students where they're at. We're going back to that human-animal bond. And studies have shown that if you're engaging students, even if that animal is not their own, it helps bring connection. So we're teaching students that across campus, we can get you plugged in into different outreach initiatives that fit for you. We have several others that we intentionally ask students to attend. I'm very intentional with my group of 155 students in my class to say, I think I see value in you attending here. Our students are learning about equine therapy. Some students have left their horses or been a horse person all their lives, and we're teaching them how to engage with children in equine therapy. We have a doggy date program through our Humane Society that we work closely with because we know students, especially nursing students, are busy. You can't have a dog, but you can date one for, just one afternoon if you need to just be walking or engaging with them. We also know that in an institution like Arkansas, like Auburn, we have these amazing mascots, right? We have 2 at Auburn. Somebody told me, y'all have 2. Well, we do. But we have a raptor center that's talking about conservation and rehabilitation. So our students, even though it's not a normal animal-assisted intervention or what some people might call normal, being engaged in conservation and working with the raptors actually helps students feeling connected. So really, if we're learning those skills and coping, that helps you be a better nurse. And as a faculty, that is my job, to help you be a better nurse. So thank you for letting me come. I enjoy coming here. This is Daisy and Sally.